Hi, my name is Natalie, and I work as an occupational therapist for interior health. I have worked as an occupational therapist for many years now, and my specialty is actually in orthopedics. So the whole point of today's discussion will be to prepare yourself for your upcoming shoulder surgery. Shoulder surgery will impact your life in many different ways, including how you will dress yourself, toilet, maybe even get yourself showered. So the various tips that I'm going to offer you today and show you will be important for you to get you ready for your upcoming surgery. Okay, it's time to start your preparation. You will probably receive an email from Interior Health. If you don't, actually, you're going to want to reach out and make sure that you get the email. That will have hopefully this link to the video and a few documents that are very important for you to read in advance. This one is an after your shoulder surgery document that will explain various tips and tricks on how to manage. And this one is actually a pre-discharge or pre-surgery handout that I think will be useful to you. Read these, and then that way that will help you get prepared for your surgery. Now that you've read your documents, it's time to make preparations by buying or renting your ice machine system. Every surgeon has their different protocols, but some surgeons do like their patients to have these ice machines to help with the cooling down process while you're recovering. So it's important to pick up the ice machine, the appropriate cuff that goes with. If you're from out of town, you might even consider purchasing a car adapter, because that will help you use your ice machine on the way home. You can see there's two different kinds here, and both are really great. The cuffs are different and they come in different sizes, so it's going to be super important to actually find the cuff that works for you. The next step is actually to apply the cryocuff pad. So Marlene is going to put it as high up as she can on the neck. Dean can help by holding the front part still. Marlene takes the longest strap, comes around the body, and secures it to the front. And then we're going to have Dean lean forward, opening up the area so Marlene can actually reach underneath and grab the second strap and apply it to the front part there. That's the main strap keeping the cuff in place. And then lastly, we want to actually reach down again, lean forward as Dean is doing, perfect, and attach the third strap, which goes around the bicep tricep area. All right, Marlene is going to demonstrate just how to apply a second type of ice cryo cuff. This one is a little bit easier. It only has 2 straps. Although coming out of the package, the straps can be a little bit tricky. So again, my suggestion is take them out of the straps or take the straps out of the bag and actually look at it pre-op to make sure that everything is fitting well. Next step, you need to make sure you have appropriate clothing. I would suggest getting a button-up collared shirt that's a little bit on the thicker side, because you're going to want to have that on underneath your ice machine cuff. The collared shirt will protect your neck also from any type of rubbing or unwanted feelings from the cuff and the sling. You will also want to have some loose fitting bottoms that will be easy to pull on, because remember, you will be down one arm and you will only have your one other arm to help you with pulling up your bottoms. All right, the last thing you need to do is to make sure you have your support person lined up. It's not going to be very easy to put on your own shirt, put your cryo cuff on with only one arm that's working. So it's super important to find a spouse, a friend, a loved one, somebody who can come with and be with you for the first few hours, few days actually, after your surgery. The one thing I need to remind you is practice does make perfect. So get out your biggest shirt, practice putting it on as if you've had surgery on your shoulder. Get your cryo cuff and your ice machine working. Make sure there's no leaks. Practice doing things like feeding yourself, especially if you're not going to be able to use your dominant hand. So feed yourself, get yourself dressed, and maybe even practice wiping yourself, because it's not as obvious as you think. So if I can give you one last piece of advice is practice, 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 and I look forward to seeing you post-op. Good luck.